They will engage stakeholders to streamline the relationship between the Ministry of Health and Education on the training of medical students. They will expand scholarship for specialist training to cover other health professionals in Ghana. They will collaborate with the private sector in the placement of health staff. They will recruit more nurses, doctors, and other health professionals with improved conditions of service. They will partner with real estate developers, including the State Housing Corporation, the Tema Development Corporation, to provide housing schemes for healthcare workers. The people who promise teachers 10,000 houses. When I add it to you, understand, they will enhance incentives for public health workers in rural and deprived areas or designated areas of need. And lastly, introduce incentives for health workers to buy one vehicle each with engine capacity of 1.8 liter. And the explanation is that they are not buying the car for you, but when you bring the car, you pay duties.
But let's look at the expand scholarships for specialist training to cover the healthcare professionals in Ghana, to collaborate with the private health sector in the placement of healthcare staff, recruit more doctors, nurses, and other healthcare professionals. So do the recruitments, yes. Do the training, yes. But this brain drain, especially of our specialists, people who have been trained and help, put your phone down, let's work. And do some of these things. Question that you ask yourself is this. You have given the training opportunity to the individual, and yet the person is living the shores of this country. How do we benefit? What is being done to ensure that we maintain them in this country to serve the citizens of this country?
So that's where the incentives package comes in. The last time I told you about 4 days ago, a conversation I had between and he's a fine advocate for the Ghana Medical Association, the General Secretary, Dr. I think Salome. Yes, Salome. Then there was also Kwame Sapon. There was the presidential advisor on health, former CEO Konfanoche, Dr. Nsiansari. And Dr. Salome made a fantastic point. He works in the Hafu region. He even survived a robbery because of the nature of road there. Why should Salome earn, say, 1,000 cedis and somebody at Kolebu earn 1,000 cedis?
Just like a teacher who's in Kumasi and a teacher who's in a rural area somewhere.
Exactly, at Dujama, for example. And Salome asks the question that, what's the opportunity, the incentive? Because you see, the person in the
motivation that will let me go to a rural area and work.
Yes. So for me, the incentives, they need to be specific. See, the incentives is broad. What? Dave, if it's nurses' quarters, and I heard Dr. Mahong Bami or somebody say medical village, I don't know whether it's Mahama or one of them. So one of the parties are promising medical village, David, which is very important. If, for example, a young doctor finishes, is it the housemanship?
Yeah.
And he knows that I'm going to Shidim. I'll get a 2-bedroom, right? There's a small car, there's Vetson, right? So we be and youngness, and all that, extracurricular activities, which is all good. Dave, the person will go. But if the person is the same, on the same salary stream, the same everything like someone in Sunyane, it's not fair.
But you know,
so they need to specify the incentives.
Aside from the emphasizing on that, if you speak to healthcare workers, you go to a rural area, and the facility there itself and the equipment there itself will not help your practice. So aside from the incentives, some of them are like, why should I go to this rural area where I don't have A, B, and C in terms of equipment to work with?
And Dave, Kwame Sapon said what he said, that medical training is a vocation and not just the theory you study in school. Because there's what we call skill atrophy. The more you are not practicing, the more you are losing your skill.
Yeah.
So the more you are having the machinery and the equipment to practice.
So if you go to a rural area where you don't have some MRIs, you don't have some CT scans, you don't have some equipment to work with, and you meet your peers whom you completed school with, who also tell, oh, we did this and we're doing this and we have this and we have that. It's not encouraging enough. So the incentives are well and good, but let's make sure that we retool, stock the facilities, the health facilities, so it will make people who go there to work know that Charlie is the same as in Kofanoche or as in Rich Hospital or any other place. Let's move on.
Yeah,